But breast augmentation is a very common procedure. I do it routinely here. You have options of silicone or saline implants. Silicone implants have become more popular. They're a newer generation. A lot of people refer to them as gummy bear or cohesive gel implants. So even if they are ruptured, they don't leak. They stay contained in their area, I suppose. The women come in, we help them size for their anatomy, what type of implant can they accommodate. There's hundreds of styles of implants that talk about profile, their diameter, their projection, and based on a patient's measurements and their goals or their desires for what their breast shape and size should be, I then can help fit them with an implant that'll help them achieve their goal. And so when we do this surgery is done at a surgery center. It's under general anesthesia. Patients have several incision options. We can go from around the areola, underneath the breast, or from the armpit. The most common and easiest recovery is underneath the breast. So we do that mostly, but can accommodate other incisions as well. With saline, you can also come from the belly button in certain instances. But again, the most common is underneath the breast. We can then place the implant directly behind the breast or the areola in that position. Typically we go under the muscle. That's the most common way to do the surgery. So we have to release the muscle from the chest wall, and that's a little bit of the recovery of a breast augmentation surgery. But most girls tend to want to go underneath the muscle. It's the most common way of doing it nowadays. The muscle gives it more protection, having more tissue on top of the implant. Plus it helps hold it up, fighting gravity, so they don't tend to droop over time, compared to if they were just done underneath the breast or skin. You're just counting on that to hold it up, and it tends to droop over time. So under the muscle tends to be the way we do most of these surgeries nowadays. So once I help a girl decide on a size and style of implant to give them their desired look, we do trials. So we put on a bra and let them size, and put on a t-shirt to make sure it's the volume and the shape that they're looking for. And once we kind of confirm that, we move forward with surgery. And again, the surgery is done at a surgery center. It takes about an hour. Typical blood loss for this is less than a teaspoon of blood during this surgery. The incision's very small. It's about 4 centimeters, less than 2 inches. And these implants are squeezed in using what we call a Keller funnel. And it's a funnel so that I have to minimally touch the implant, which is thought to help patients heal and reduce any side effects or complications. For patients that have had existing or previous breast augmentation and have existing implants, and they either have an issue or a problem with them that they need to have addressed, or they want to change size or go bigger or smaller, change from saline to silicone or vice versa, or they just had the implants for a long time and feel they need to be changed out. A real common procedure is what we just, it's called remove and replace. It's very similar to a straightforward breast augmentation. However, the dissection in the pocket is essentially already created for you. So it's an easy recovery and minor adjustments and things can do to help the appearance of the breasts. At that time, we can do internal lifting, we can tighten the pocket, we can loosen the pocket. There's several things we can do to help accommodate a new style or different implant, as well as maybe tweak or modify the breast just a little bit to give a better appearance. So commonly, we try to keep a very natural look. There's some women that definitely want a more augmented look, and I can help them achieve either way. But the general trend in kind of my practice is to maintain a more natural look. That's definitely very common. But occasionally there's some girls that want a more round or augmented look and definitely want everybody to notice that we can help them achieve that as well.